Hi everyone, and welcome back to our very last episode of CF with Diamond, Vanessa, and Allie. In this episode, we will recap on other episodes, and we will end our show with how CF affects the respiratory system. What do you remember about the CF? What is CF? CF is short for cystic fibrosis. It is a progressive genetic disorder that clogs up the lungs, pancreas, and other organs with mucus. In order for someone to have CF, they must have the mutated CFTR gene, which is the cystic fibrosis transmembrane conductance regulator. When that becomes dysfunctional, it alters the mucus secretion of the body's epithelial cell. And when that protein doesn't work correctly, it is unable to move chloride, which helps attract water to the cell surface. Without water, the mucus becomes very thick and sticky. So what does CF affect? CF affects many organs and body systems, and as you may recall, we spoke on how CF affects the integumentary system, the skeletal system, the circulatory system, the endocrine, the reproductive system, and today we will add on the respiratory system, which is the most affected by CF. The integumentary consists of the skin, hair, nails, glands, and nerves. So a person that is affected with cystic fibrosis will have salty, sweaty skin. The defective CFTR gene causes a malabsorption of salt in the body, causing it to be released through the skin. Salt helps retain fluids in the body, and someone with CF without salt, their body will be losing large amounts of water, causing dehydration.
The skeletal system consists of the bones in the body. People with CF have low bone minerals and are at risk for osteopenia and osteoporosis. Osteopenia is a condition when the body does not make new bone as quickly as it reabsorbs the old bone. Osteoporosis is a condition where your bones become weak and brittle so they could break more easily. The body constantly absorbs and replaces bone tissue, but with osteoporosis, new bone creation does not keep up with the old bone removal. CF patients have a harder time because these bone disease makes it harder for the CF patients to breathe, and the pain feels much worse. Nervous system abnormalities seen in cystic fibrosis patients have been attributed to the consequences of CF or its treatment. To be more specific, the changes are in the peripheral nervous system, including neuropathy. The protein affected in CFTR is expressed and functions in a Schwann cell. Schwann cells produce the myelin sheath, a fatty acid that insulates nerve fibers around neuronal axons. This allows efficient transmission of nerve signals. Studies have shown that the loss of CFTR protein directly alters Schwann cell function and leads to subtle structural abnormalities in the myelin surrounding the nerve fibers. CF can cause multiple endocrine disorders, which include diabetes, bone disease, short stature, and male hypogonadism. There are many factors for these causes, but may be directly related in some cases to CFTR dysfunction, or the CF transmembrane conductance regulator. Diabetes is the most common endocrine complication and can be expected to affect in almost all people with pancreatic insufficient CF. CFRD, or CF-related diabetes, is characterized by reduced or delayed insulin secretion, with generally normal sensitivity to insulin action. The main complications of CFRD are worse lung disease, poor nutritional status, and increased mortality. So, CF patients show some complications as a diabetic patient. The CF-specific complications have been shown to improve with the treatment of CFRD. In the pancreas, the buildup of the mucus prevents the release of the enzymes that help absorb food and nutrients. In the liver, it blocks the bile duct, causing liver disease. CF can affect the reproductive system, especially in men. CF causes male hypogonadism, which is also known as testosterone deficiency. It is a failure of the testes to produce the male sex hormone testosterone, sperm, or even both. The thickened secretion caused by CFTR dysfunction may obstruct sexual organs like the sperm canal. The causes of cystic fibrosis-related bone disease are multifactorial and include nutritional deficiencies of vitamin D, K, and calcium, as well as glucocorticoid use and sex steroid deficiency. It also alters the growth hormone axis, which is a reason CF patients have a short stature. In regards to myology, CF causes peripheral muscle weakness, which is due to CF patients having exercise intolerance. The exercise intolerance in cystic fibrosis is attributed to the diminished nutritional and pulmonary function, as well as lung exacerbation.
In the circulatory system, hypoxemia and inflammation are among the most important factors for heart involvement in cystic fibrosis. Cystic fibrosis transmembrane regulator was found to be involved in the regulation of cardiomyocyte contraction and may also be account for cystic fibrosis-related myocardial dysfunction. High-fat diets are also known to put patients at risk of ischemic heart disease. Hypoxia and disease severity have also been implicated in the finding of right and left ventricle enlargement with systolic and dysystolic dysfunction seen in CF. Electrolytes are substances in blood that are critical to cell function. CFTR mutations cause changes in the body's cell electrolyte transport system. Hemoptysis or coughing up blood is one of the scariest complications of cystic fibrosis. As we mentioned, CF affects mainly the respiratory system. In the lungs, the mucus builds up, causing blockage to the airway and traps bacteria, causing chronic infections. The buildup is caused by an abnormal gene called CFTR, cystic fibrosis transmembrane regulator. CFTR controls the flow of water and salt in and out of the body cells. Changes cause mucus to become thickened and sticky. This first affects the small airways in the lungs. Over time, it can affect all airways. Now, does CF have a cure? Currently, there are no cures for CF, but there are treatments that can help manage symptoms and reduce complications. Patients can be given antibiotics to reduce bacteria, to prevent inflammation in the airways, mucus thinners to help break up the mucus, and bronchodilator to open and relax muscles around the bronchia. There are also procedures like bronchoscopy, bowel surgery, and lung transplants, and therapies like enzyme replacement, chest physicals, oxygen and breathing exercises. There are many foundations that can help fund research for cures of CF. That is all we have on cystic fibrosis. Thank you so much for listening to our show. Bye.